One of my very first challenges when I took over as system manager was given to me by my chief medical officer. One of the hospitals had fallen off the top 10 hospital list. He called me into his office and he said, "Find out why we're off and get us back on there." One of the first things I did was contacted my Nuance rep. We found out that it was the surgical complication rate, so I immediately educated the physicians, the coders, and the clinical documentation nurses, and our reported complication rate dropped from 14% to 3%. Within 2 years, we were back in the top 10. I got to keep my job. We have maintained that status, and I think a lot of it is because of the leadership we have at the hospital as well as the support of Nuance. From a clinical documentation nurse standpoint, I think one of the greatest advantages is the education that's involved. That education is something that I have not seen in any other program that I have reviewed. The reporting that is available is invaluable. It goes to the chief medical officer, it's provided to the financial officers. It not only provides them with the productivity of our department, but it also helps them to determine how well we're doing compared to our peers. I think another important factor is the emphasis that Nuance has on having their program staffed by clinical nurses. Because of that, we have about a 98% response rate to our clarifications. Our physicians recognize the program, they appreciate it, and they respect it. I was very excited to learn that Epic and Nuance have become strategic development partners. Those are two of the vendors that we chose first off, which says something about the quality of each. The impact of the Epic and Nuance partnership, it seems as though the possibilities are endless.